Okay, so today's top tips, I'm going to talk about patellofemoral pain and the potential for it with plyometrics. And this might be very relevant for those patients that don't actually have patellofemoral pain, but you've been going through programs such as an ACL reconstruction, rehabilitation, and you want to proceed into plyometrics, but you're aware that they might perhaps have a lot of risk factors for patellofemoral pain, or it might be a patient who has had patellofemoral pain and wanting them to return to a jumping type sport, and you need to be careful how you approach this. So what do we need to be aware of? Well, quite simply, this picture on the right shows good and bad techniques. So that picture you're looking at there on the left shows we've got knees nicely over feet, and on the right we've got knees dropping in. So that can be adduction, or it can be internal rotation, or obviously both. And when it drops in like that, we've got a huge valgus moment at the knee, which is going to overload the lateral side of the patellofemoral joint. And this can be through a strength deficit proximally. So as we can see here, Lawrence's paper in 2008 shows that static weak external rotators correlates with poor landing technique. But it might actually also be that it's neuromuscular, so the strength is there, but they're not using it, and they've got bad habits from previously, and that they need to be re-educated to good quality movement. Also be aware that foot width is really important. It's very difficult to keep your knees over your feet if your feet land very wide. And if you have someone doing plyometric training and they're jumping repeatedly, and each time they land there's a different distance between their feet, then you need to consider that that is harder for them to consistently keep knees over feet. So perhaps work on that awareness and control of the distance between the feet. And the wider they go, the harder it is to avoid that valgus moment. I do quite a lot of work with skiers, and we see this in skiers, particularly on steeper terrain. The lower ski will sometimes drift away from the upper ski, leaving them in a vulnerable valgus position. And of course, this isn't just vulnerable for patellofemoral pain, but it leaves the ACL vulnerable, and also in a situation like skiing, the MCL vulnerable too. So remember, make sure you look at proximal strength, so they have the strength to have the good control. Then make sure they are using the strength, in other words neuromuscular, proximally, and then make sure that their foot width when they're doing the plyometrics stays consistent. That way you're going to hopefully set the patient up for their return to sport, which leaves them well equipped to avoid further injury or development of patellofemoral pain. If you'd like more tips on patellofemoral pain, have a look at my website www.clairepatella.com. Thanks for listening.